Hi, everybody. Welcome to 10 Minutes with JPIDS. I'm Ravi Jhaveri, your editor-in-chief, and I'm really excited to have as our guests today Drs. Preeti Jaggi and Shreya Doshi. They are the guest editors of our recently published series in partnership with Open Forum Infectious Diseases about climate awareness, sustainability, and justice with an infectious disease lens. So welcome to both of you.
Thank you for having us.
Thank you.
All right, so the listeners that we have thus far know that I start with the same question, which is I'm a superhero nerd. And so I like to ask everyone their origin story. So perhaps you can both share your origin story. How did you get involved in infectious disease? Preeti, let's start with you.
I was very interested in infectious disease from my time in medical school. Just seeing one of the infectious disease doctors that I had in my hospital who was really thought very broadly about the patient. They kind of thought about prevention of future infections and really every system of the body. And I really enjoyed that. And then I also had a very great diagnostician attending when I was a resident. And that's how became really interested in infectious disease.
Okay, and I'll ask you the second question also before we move to Shreya, which is what was your first paper that you published?
My first paper was actually with a neurologist in the PICU. They were using a non-invasive way to look at electrical activity. And so that was my first paper in residency. So not an ID paper, very soon after I started switching over to
That's all right.
group-based
Writing is
streptococcus papers and things like that. But that was my first paper.
love it. Okay, Shreya, let's move to you. How did you get involved, or how did you decide you were going to go into ID?
I think I was always interested in infectious diseases, growing up in Mumbai and going to med school in India. So it kind of felt like a natural transition. I also love how we're, problem solvers and, ID so multi-systemic. So I loved all those aspects of ID.
Okay, and then your first paper?
Well, since you're meeting me so early in my career, this is actually my first paper.
All right, love it. There had to be somebody who this was the first. Okay, so now let's pivot to sort of the second origin story, which is how both of you got involved with the concept of sustainability within infectious disease. Where did it start, and then how did you two get connected?
I can go first. I've always been extremely interested in how the environment plays into infectious diseases. We ask so much about animal exposure and, being immersed in water and things like that that are leading to infectious diseases. I've been, really following this kind of climate change story for a long, long time and sort of thought about it as my sort of something that I'm interested in. But as I went along, I'm getting more and more alarmed about how it's really actually affecting us now. And as a pediatrician, I am interested in, children's health and especially global public health. And then actually kind of settled along on sustainability as something that I could actually do. I have done a lot of advocacy work with government leaders and my hospital, but with sustainability, it's something that you can actually bring into your work every day. So it makes it more doable.
Okay, Shreya?
I always had, doing something public health related at the back of my mind. And then I happened to see a case of a 10-year-old with extremely drug resistant Salmonella typhoid. At the same time, she had just traveled to Pakistan where they had floods that had, the flood waters had damaged two-thirds of their country. So it made me think how the flood waters is like further going to impact resistance. And that's the time when I was trying to decide what should be my focus of research within infectious diseases. So I was talking to my mentor, Rana Hamdi, who you know through JPIDS, and she connected me with Preeti. One thing led to another. And I didn't know that healthcare sustainability would become like a career pathway for me like it has now. So it's been quite amazing how it has evolved.
Yeah, I love that. I think the lesson, if I would just point it out, I feel like the lesson for our readers and for people going on is that inspiration is sort of around us every day, and you sort of seize upon it, and then it's up to you to sort of ask the next question, get to the next level in how you pursue it. So I'm going to put a gold star on that point. Can you share with us what it's been like to organize this series of articles?
I think it's been really, really fun. I think many of us, nobody's really an expert in sustainability, but there are some more experts in sustainability, but not many people in infectious disease. So we were all kind of learning at the same time. And also it built a lot of camaraderie for people to write the different articles, look at the literature, and really learn together. I think that was really, really fun.
Shreya?
Yeah, I would echo that. I think as a fellow, it's been quite a transformative experience um for me, and getting to make a lot of connections with authors from all over the world. um you know kind of seeing how articles move, like what the timeline is for each article, and like see the whole process. It's all been a great learning experience, and it's kind of become like a foundation on which like we're further building other healthcare sustainability and ID projects.
I love it. Do as you obviously you are hoping that this drives not only awareness but perhaps action. So as you think about the topics that are covered in the supplement, maybe if you could just give us a high-level summary of the topics that are included, and then the follow-on question is, how would you like that to sort of spurn further action and awareness amongst our JPIDS readers?
So the way that we kind of organized the supplement was an overview article about sustainability in general. 8.5% of US greenhouse gas emissions are associated with healthcare delivery. So that's the scope of the problem. We tried in the first article to really set up just some context, kind of what can you do? We used the We Act mnemonic from the Providence Health System. W for waste, E for energy, A for anesthesia and anything along the agriculture or food cycle, C for chemicals, pharmaceuticals, and supplies, which is actually the biggest chunk of greenhouse gas emissions associated with healthcare, and T for transportation. And then within that, we had different topics talking about greening the labs, including a microbiology lab, outpatient medicine, like telemedicine. We talked all about those things, and kind of everything sort of, we use that sort of framework to sort of give you an overview about all the things you can do. And then each article kind of delves a little bit more deeply into one of those topics.
I'll add to that, so we also spoke about one of our articles also about environmental sustainability in the outpatient setting. And then the lab article also has a global perspective, because I don't think everybody realizes, but a lot of the things that we're doing here in this country have an impact on climate events in other countries. So I think that perspective coming from some global authors was also very important.
And then how about sort of driving local action? What tips or advice do you have for people?
We talked a little bit about sustainability committees and what people have done to try to get those committees at their hospital. A really good example is in Pittsburgh, that they did a really nice organizing event. Actually, one of the people that was in that was a pediatrician, and they have a sustainability group at that hospital. So we give a lot of examples of what different efforts are being done in different hospitals. And we also try to give some examples about, how we can to incorporate this in infectious disease. We talk about infection prevention. We talk about antimicrobial stewardship. Antimicrobial stewardship is really sustainability. If you think about it, it's high quality care. IV to enteral conversion is a huge way to decrease a lot of solid waste. So we do a lot of that every single day. So we were trying to actually kind of bring awareness to some of the activities that we're already doing that actually are healthcare sustainability, but you just need to measure something different than you're measuring right now. And then we also pointed people to the UK Center for Sustainable Healthcare. They have a really nice kind of ways to measure greenhouse gases. So we pointed people to that as well.
I also really like the table we have in the initial article, the call for action, where we break it down into education. So we want more of us to create educational modules in climate change and sustainability. Right now, this is an evolving field, as I mentioned, and we're just starting to create some, specific to ID climate education content. Um, and then we also mention funding and publication opportunities within this field. So, hopefully encouraging more journals within ID to do that, as well as incorporating, like Preeti mentioned, SUSQI. So what we're saying is no matter what you're doing within ID, maybe one of your secondary goals or your primary goals could be a sustainability objective in your research. Having more formalized committees within all of our ID societies. And then we also mentioned job creation. So there is some dedicated FTE for sustainability in a few hospitals around the country now. I want to say 20. And we're saying that because ID leaders have experience in, collaborative leadership through their prior infection prevention and stewardship work, we can be the leaders in sustainability. And then lastly, as Preeti said, expanding diagnostic stewardship, also like expanding this concept of environmental stewardship to how we order like radiology imaging in addition to like all our lab testing. So I think this table summarizes it pretty well.
Yeah, no, I love that. And I'm just curious that, as I think about how much work we do that, like you said, really aligns well with sustainability efforts. Like when
Mhm.
you are participating on development of CCGs at your hospital, do you have a separate sustainability initiative that you highlight? Maybe not upfront as the top goal of a CCG, but as a important secondary goal for whether it's IV to PO conversion or more
Mhm.
prompt de-isolation of patients who from contact precautions if it's not evidence-based and
Mhm.
not warranted.
And the other thing that the UK folks are doing is they are looking at best clinical outcomes with the least social, environmental, and financial harms. So there's actually some ways that you can just start labeling some of the social benefits. If you do telemedicine, are you potentially avoiding missed days of work for the family?
Mm-hmm.
Missed days of school. When you do IV to enteral conversion, don't just think about the solid waste that you're saving from going from IV to oral, but think about the nurse's time
Yeah.
that you might be saving and the EVS workers' time. So when you start labeling the social benefits, you may not be able to quickly measure that, but even just labeling it makes you really think much more. I was looking at one of the SUSQI process maps. And the process map starts with patient drives to the hospital, parks and pays for the parking,
Yeah.
then goes in. It doesn't start with MRI is obtained. It's
Right.
so interesting. I think that's a really neat way to kind of expand on what we're doing and look at it
Yes.
more holistically.
For sure. And I apologize to our listeners. I assume that everyone works at my institution. CCG in our lingo is clinical care guidelines, or many of you may call them clinical pathways or something similar, but they all mean the same thing, I think, in terms of
Mm-hmm.
having patients with the same diagnosis sort of follow the same line from diagnosis to management and follow-up.
And even when we're thinking about central line associated bloodstream infections, if you think about not only antibiotics, but the other drugs that are IV, the H2 blockers or those kinds of drugs. So using our expertise in IV to enteral conversion, we can start applying that to other things. We just came up with a protocol at our hospital and we started thinking about anti-epileptics. And a lot of those can be switched to enteral. And those also decrease central line access or peripheral IV access, and that may prevent central line associated bloodstream infections or peripheral IV extravasation. So that's just another way of it. You don't look at environment alone. You look at environment also in the context of all these other things.
Yeah.
And I think that really makes a lot of sense to me now when I try to apply that framework.
All right. So in the last minute or so, what sort of closing thoughts or take-home points do you guys want to put on a bow for our listeners?
I would say everybody can start somewhere. So start with your own hospital sustainability committee. If you don't have one, just get together with some like-minded people and, you'll see the ripple effect. You start with one project, it'll lead to something else. So, and then, well, at the, committee level, you can always join Sustainable-ID as well. So there's something for everyone in ID with respect to sustainability.
Very well
Anything?
said. I think that I definitely agree with everything that Shreya just said. And also just you may be already doing some healthcare sustainability and you just don't know it yet. You just haven't labeled it yet. And so I think just starting that conversation is really helpful. And then also, especially with infection prevention activities, starting to think about what are the environmental costs to some of the practices that we have. So we need to have more conversation about that. When some centers are, just really trying to make sure that people know when to use protective equipment and when not to need it. When do you not need it? When do you put biohazardous material in the biohazard bin versus not? Don't put things that are not biohazardous in that biohazardous bin because it has to be autoclaved or incinerated. So there's just little things that you might be doing already that you can incorporate sustainability practices into.
Excellent. All right. And so I would parenthetically add to our listeners that as you make these changes locally, regionally, nationally, or internationally, be rigorous in how you track your outcomes and collect your data, and then write it up. And we at JPIDS would love to see that work and consider it for the future. All right. I want to, thank both of you for your efforts in this space and creating sort of a niche and identity and a pathway for so many in our field. I congratulate you for the work you've done, and I look forward to what you're going to do in the future. Thanks so much for being here.
Thank you.
Thank you.
All right, take care all. See you next time.